there is a lack of uniformity in methods to determine capacity to consent in research, and very few studies use instruments to assess consent capacity. Hello, I am Dr. Maria Lapid, Professor of Psychiatry.
And I'm Dr. Bart Clark, Professor of Medicine.
We are both from the Mayo Clinic in Rochester, Minnesota. We are excited to tell you about our article in the Mayo Clinic Proceedings entitled Research Involving Participants with Impaired Consent Capacity, an Examination of Methods to Determine Capacity to Consent. As a background, determining whether a person is capable or not of providing informed consent to participate in research reflects the basic ethical principles of autonomy and respect for persons. However, there's no single method to assess recent research consent capacity, although the gold standard is the clinical interview. When an instrument is used, ideally the instrument should assess all four components of decisional capacity, including understanding, appreciation, reasoning, and ability to communicate a choice. For our methods, we reviewed 330 Mayo Clinic research protocols involving participants lacking capacity to consent. We looked at the methods described in the protocols for assessing consent capacity and compiled a list of instruments used in this capacity determination. The results were interesting. The top three specialties involving participants with impaired consent capacity in research were neurology, critical care, and surgery. The types of studies were observational studies, clinical trials, chart reviews, biobank protocols, and biomarker studies. The most common method to assess capacity to consent was direct assessment by investigators. Interestingly, only 1/4 of the studies utilized instruments to assess consent capacity, as listed in Table 2 of the paper.
These findings suggest that investigators used to caring for patients with impaired capacity know it when they see it based on clinical judgment and usually involve legally authorized representatives when obtaining consent. Investigators not used to caring for patients with impaired capacity generally know what to do, but would likely benefit from a guide for structure to make sure that an adequate assessment is done.
As clinicians, we generally recognize impairment in a patient when we see it. Any clinical suspicion for cognitive or decisional impairment needs further evaluation. Especially in research involving participants who have impaired capacity, we need to make sure that they are able to provide a truly informed consent and balance their autonomy in making decisions with the need to protect their rights and welfare as a research subject.
The bottom line is to increase protections of human research subjects by obtaining truly informed consent from subjects that have the capacity to do it. If subjects don't have capacity, then informed consent needs to be obtained from legally authorized representatives or other surrogates. We want to optimize the protection of human subjects.
Thank you, Dr. Clark, and thank you everyone for watching.
We hope you found this presentation from the content of our website valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you'll find access to information for our social media content, such as additional videos on our YouTube channel or journal updates on Facebook. You can also follow us on Twitter. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This video content is copyrighted by Mayo Foundation for Medical Education and Research.